collaborate and we sensitize our communities to fight polio in our community. Sasa nataka how do they say? Wanajua Swahili iko very hard, lakini nitajaribu kuelewa hizi. Yes, sasa tunakuwa na meetings ya cross border na security na mheshimiwa ECC. So we are happy. It is not our first time to fight a common goal. Tulipata anthrax sometime last year. Tulifanya together. So I'm happy to be here and I'm happy to be with my team. Me iko team from Uganda. I don't know whether they could stand up and we at least introduce yourselves. Mnajua na mimi nakuja na watu. Am I communicating? So I don't know whether they could introduce themselves. They should. No, they could. You can come in front, please. They should, yeah. You should come, all my Ugandan team that I'm delegating to Kenya.
Habari Kenya. Habari East Africa. We are happy to be here. Mimi Afajina Immaculate Ampeire, Kazi Minister of Health Uganda, immunization. We are happy to be here to join Kenya's efforts in fighting vaccine-preventable diseases, and we are starting with polio. Polio must live. Thank you.
Good morning to you. My name is Dr. Amos Chijambu. I'm from Ministry of Health, an epidemiologist, and I'm supporting Namisinda district in this campaign. Thank you.
Thank you. Thank you so much. I'm Annette Bogere, Surveillance Officer, Namisindwa District, and I also serve Namisindwa as the District Health Educator. Thank you so much.
Thank you. This is Dr. Masai Was Stephen, District Health Officer, Namisindwa. We have been always kicking polio to Kenya, but now you're kicking it back to Uganda.
Thank you very much. My name's Haji Kasim Kagwadumba. I'm a Social Behavior Change Communication Officer with the Ministry of Health Uganda.
Good morning. I'm known by the name of Wabiaka Maureen, in charge of Bungoma Health Center 2, Ruakaka.
Good morning, everyone. My name is Nadutu Esther, Health Inspector in charge of Ruakaka Town Council, working as surveillance focal person, Bungoma Health Center 2, Ruakaka, just a neighbor here. Thank you.
Good morning. I'm Charles Muhumuza. I work with the Ministry of Health in the immunization program. Thank you.
All protocol observed. Good morning, everybody. I'm called Muyama Martha, the Minister of Health and CBS in Namisindwa District, in for the Governor of Namisindwa District. You are most welcome. Thank you.
Good morning, ladies and gentlemen. Esther Molov is my name. I work with the Mbale Regional Emergency Operations Center, and I'm glad to be in Kenya for the great collaboration that you worked with us during COVID-19 and also today. Thank you so much.
Good morning, everyone. My name is Samuel Ofori. I work with the Bill and Melinda Gates Foundation in Uganda. Thank you very much.
Good morning, everyone. My name is Richard Sechitoleko, and I work with WHO in Mbale region. Mbale region also, Namisindwa is part of Mbale region, so I'm happy to be here.
Good afternoon, ladies and gentlemen. Tenywa Emmanuel. I work with World Health Organization. I'm based in Kampala. I'm happy to be here as we begin our journey of the collaboration between the countries beyond Kenya and Uganda. We shall be collaborating with the other countries, Sudan, South Sudan, Ethiopia, and others. Thank you very much.
All right, good afternoon to us all. Protocol observed. My name is Oskol Emmanuel. I'm coming in from the Mbale Emergency Operations Center, which is a coordination point for all public health events, and that's why we are here. Thank you.
Good afternoon. Kwa majina naitwa Timbiti Joffre. I am the Chief Administrative Officer of Namisindwa District. I don't know what is the equivalent of a cow in Kenya. A cow is the head of all the civil servants in a district. So I don't know my equivalent here. He's the accounting officer of the district. So maybe I will get somebody to explain to me. But I'm glad to be here. Thank you so much for welcoming us. Tunashukuru sana.
Watu ya Kenya tumeshukuru sana. Mubere bulungi.
Nashukuru sana. Sasa munipatie nafasi na kusikiza wageni wetu, tuwapigie makofi tena. So kwa sababu ya muda, NTV we are live. So lazima tumepatia saa moja. Niruhusu mgeni wa heshima nimwalike Kipchumba ili anene na sisi. Bwana Kipchumba, Senator Kipchumba, nafasi ni wako sasa.
Thank you. Our chief guest, Dr. Matende Chero, officials from the Ministry of Health, officials from the county government of Bungoma, development partners, parents, champions, county commissioner, and friends from Uganda. Good afternoon. As I was a child, at the age of 4, I nearly died. I nearly died because of a disease that kills, and if you don't die, it disables you. I have lived with the pain of not able to use my limbs. I have lived through discrimination and pain of not growing up like any other child, and later as an adult. I was forced to live on crutches over many years, and now I am forced to stand on a wheelchair. Polio. Polio is the cause of my pain. Polio has left me with a wound in my heart and my life. Polio has caused pain to my family, to my community, and even now, to my country. I thought by 2020, we are done away with it. I thought there was going to be peace among my children and my people, until I was called back
few days ago that the disease that has no cure has visited my people again. It is the pain that I don't want any other child to live. In the next few days, from today to Sunday, we can change that situation. You can save a child from the pain of living with disability if they don't die. We are able to give a gift to our children not to live the pain I and others continue living to date. And therefore, I want to call upon the leaders, Waziris. You are the people that if only did anything when I was 4 years, I would not be on crutches. Can you do it now for these children? I call upon County Commissioner. I suffered because the administrator, whether the chief or DO or DC at that time, did not walk to our home and have me vaccinated. Don't allow another child to suffer. I call upon you to work these 5 days with the administrators, with the village elders, health workers, Ministry of Health team. Let us invade the village and save our children, because polio is going to kill them. We can save them because polio is preventable through vaccine. I have the Bungoma champion. May he stand up. Davis Kiboy. That is the Bungoma champion, another victim of polio. So it is also around here. Let us rise up. Our neighbors from Uganda, please walk with us. Polio has no nation, has no country, has no boundary. And polio does not discriminate. Just walk across as we walk across to make sure that no child suffers from polio. Thank you.
Wow. Hiyo ni heshima kubwa, Senator Mheshimiwa Kipchumba, Mheshimiwa George na waziri wetu wawili. Tumetembea na yeye. Kwa hivyo basi nitaomba tu wafuatao tuwafupishe kabisa. Tutakuwa na mwakilishi wetu kutoka Kenya Red Cross. Tafadhali na kualika ili upatie ujumbe. Tukifuatiliwa na mwakilishi wa UNICEF na baadaye WHO. Karibu sana. Tumpigie makofi tafadhali.
Asante sana. All protocol observed. Good afternoon. Allow me to just thank us all for coming here. And of course, it is just a very great honor to have been opened this session by the champion for polio. Thank you so much, Mheshimiwa Senator. And of course, he has said, and I will reiterate, that polio is not just a health challenge, but it is a threat to our collective future. Meaning then we need to check that our children who are below 10 years are fully immunized or vaccinated against polio. It is a matter to every family, every child, and communities across. And as you can see, we have already started cross engagements with Uganda. And of course, Team Uganda, I was already trying to check if we would have Uganda Red Cross representative from this side, but I know you will do going forward. And we want to say that as Kenya Red Cross, we are really proud to be standing alongside our partners and the national government, including Ministry of Health, WHO, UNICEF in this life-saving effort. Our role in this campaign is to mobilize our volunteers fully, who are well represented here, and the volunteers are mandated to help us in mobilizing communities, raising awareness, and ensuring that every child receives the vaccine. And Bwana DG, we will work closely with the CHPs who are also registered as our volunteers to help make sure that this happens. A commitment that we want to make across is that we will be at the forefront of public health initiatives to respond to emergencies and, of course, work tirelessly to prevent diseases. In this campaign, we want to ensure that our volunteers across all the way from the urban and peri-urban areas are in the forefront to help our communities understand and take part in this. Finally, a call to action for all of us is that as we stand at this crossroads, the threat of polio has not disappeared. And of course, neither our resolve to eliminate it has reduced, but we are increasing it day by day, that we have to ensure polio disappears. So finally, allow me to say that we should not forget that while polio may be our focus today, our broader goal is to have a healthier and more resilient communities. Finally, let us work together to kick out polio in Kenya and at the regional level. Thank you so much.
Makofi kwa mgeni wetu kutoka Kenya ingine tena. So mtaniruhusu nimwalike Dr. Collins Tabu kutoka UNICEF. Na mkitazama upande ule, watoto wetu wanatungoja tuwapatie chanjo. So tafadhali tufumulie kidogo Dr. Tabu.
Our chief guests, my elder brother, the Deputy Director General for Health, colleagues, CECs for Health and ICT, colleagues from the MOH, other representatives and the community, I greet you all. Abandu be luaha mudembe. Mudembe lundi. Mwasangadi de bakeni. Senda udrange sa utita mudembe te. Mudembe suwa. Mudembe mia. Kodumnenda loere roskiraba na befwe. I will take this opportunity to read a speech on behalf of the representative UNICEF. I bring you her greetings. She'd have liked to be here today. She has not been able to make it. From UNICEF, just to let you know that vaccines have been the biggest success of the last century. From UNICEF, we're the largest procurer of vaccines in the world. In 2023 alone, we procured more than 2.7 billion doses for 105 countries. And in 2023 alone, again, we've procured more than 1.3 billion doses of polio vaccines. In our world today, polio was once the leading cause of paralysis. We had schools that were taking care of the paralyzed children. But we are now close to eradicating it. Since the 1988, children affected by polio have reduced by over 99%. This has only been made possible through decades of concerted efforts and mainly through vaccination. Bana befwe mlusungu, I want to let you know that in order to eliminate polio, every child in every household, everywhere, must be vaccinated. The decline that we have witnessed in immunization coverage globally has resulted in increasing outbreaks of polio. We have an outbreak currently of polio in Kenya. We have recently confirmed 5 cases in Turkana County and in Nairobi County. It is therefore essential that we vaccinate all the populations that are at risk. It is an honor for us from UNICEF to partner with you and to join you to launch this vaccination campaign today, which is designed to save children's lives. But why Bungoma? It is here in Bungoma that is very close to our neighbors in Mbale, Uganda, where we have also had new additional cases. As you know, we sit next to the border here, and therefore the risk level is high, and we are happy to be joined by our colleagues from Uganda. The current polio outbreak in Kenya is driven by a combination of factors. The COVID-19 pandemic resulted in a decline in immunization coverage, and we are still feeling the aftermath of the effects of these. We have also faced challenges due to climate change, with drought and flooding and displacements of thousands of children. Population movements from the long-lasting conflicts in Somalia, South Sudan, and with the congestion in the camps have also increased our risk. For us to be able to protect ourselves, we are here today, and we have a plan on how to address the threat of polio. The plan is simple and it is safe. We must vaccinate all our children against polio. The latest vaccination drive that we launch here today, in partnership with the Ministry of Health, targets 9 counties in Kenya with 3.8 million children identified as high risk in Kiambu, Nairobi, Kajiado, Garissa, Trans Nzoia, Busia, Turkana, and West Pokot, with 2 rounds of polio vaccination. For this round and the second round of the polio vaccination campaign, I'm happy to report that UNICEF will provide support with procuring all of the vaccines that will be used, the supplies and related logistics. We are also supporting across the country vaccine handling, distribution, reporting, retrieval, and disposal. We at UNICEF are committed to promoting high community confidence and acceptance of the vaccines and to combat misinformation. We have developed a community engagement and social mobilization strategy for this outreach. At this point in time, and in the interest of time, allow me to recognize and thank our valuable partners and donors, the Global Polio Eradication Initiative, for providing financing and technical assistance, our brothers from the WHO for providing technical support and policy guidance, and the CDC and Rotary, Red Cross, among others, for mobilizing resources and continuing advocacy for polio eradication. On behalf of UNICEF and on behalf of the country representative thereof, I appeal to parents and caregivers to protect their children from polio. There is no known cure for polio, and I'll repeat in my mother tongue. Polio bulware bukhadinende kamare sitawe. Kamare sikadio kongene kunyola chanjo. It can only be prevented by vaccination. When we give polio vaccines multiple times, you get protection for life. You need to vaccinate yourself, no kalo heraho, no kalo heraho. So you need to protect your children's future by giving the polio vaccine. It is simple, it is safe, it ensures that your children are not at risk. Ladies and gentlemen, colleagues, we've made great strides in Kenya towards eradicating polio, but we must do more. We must reach the last 1%, and no one is safe unless all of us are safe. Bana befu endo mamulubu kusiskira kumusango, kumukari, kumundu khutibya lulo molwewe. So I have to repeat, madengalo khedemo, ne fo go imano so gwanja kama go akano tawe kolonda mo ba go rangirira ba go lobefwe mo ko sa lo mar niembo ko ya mbogera niyo ngana yosi goderiana niyo ya mbogera ni mano ne mreba no nandiko ewewe no wenyo mwana wo alame ahude bulai adeka hude malata we abomrekefu lazima khode khorie anyode chanjo ya polio no kwa mano bana befwe ba papa ba mai banda befwe mohayuhengo bila huwa bana benye chanjo ya polio tawe na msangarire nesima khuba nanywe asante.
Thank you so much, Dr. Tabu. Mpige makofi. Mwambie nini kwa Kiluya. Sasa mtaniruhusu ni mwalike Dr. Boston kutoka WHO aje tupatie ujumbe lake. Dr. Boston tafadhali.
Our chief guest, the Deputy Director, Dr. Sultan, representative of Bungoma County, representative of government ministries, polio champions, ladies and gentlemen, and all protocols observed. Good afternoon. Karibu, hamjambo, mulembe. So on behalf of WHO country representative, Dr. Ablaman Diallo, who would have loved to be here, but because he's engaged with other equally important activities, I am going to lead his speech on his behalf. But this is also on behalf of all hardworking WHO officers who are supporting this activity in different parts of the country. Please, all WHO officers in different parts of the country who are here, you can stand so that you get recognized. So, WHO is everywhere. Thank you. So, our chief guest, this launch flags off the first round of polio vaccination campaign, which will be targeting over 3.8 million children in 9 countries from today up to 6th of October. The campaign will be targeting children under the age of 5 in 4 counties, including Nairobi, Kiambu, Machakos, and Kajiado. This will also be targeting children under the age of 10 in 5 countries, including Turkana, West Pokoti, Busia, Bungoma, and Trans Nzoia, with novel oral polio vaccine type 2. These counties, our chief guests, are considered to be high risk for polio transmission. In November this year, Kenya was also going to conduct the second round of polio vaccination campaign using the very same antigen. This is to ensure that circulation of the polio virus is stopped and that all eligible children are protected. This vaccination campaign is in response to the outbreak of polio that was detected in children in the refugee camps in Garissa and Turkana counties in February and June this year. This is also in response to the outbreak that was detected in our neighboring country, Uganda. Kenya will be conducting a synchronized campaign for the first round with our neighboring country, Uganda, and it's good that they are here so that we are together in this battle. Our chief guest, as you recall, the WHO Region for Africa was declared polio-free and received its polio-free certification status in August 2020. Despite the progress that has been made, Kenya and other countries in the Afro region remain vigilant to detect importation of the polio virus from countries and in other regions where polio virus is still in circulation. In 2023, Kenya, Somalia, Ethiopia, and other African countries experienced outbreaks of polio, and in response, Kenya successfully conducted 3 rounds of polio vaccination campaign in 10 counties. In addition, Kenya is continuing to strengthen routine immunization to ensure that population immunity against polio is boosted in the children under the age of 10. We commend the government of Kenya and the Ministry of Health for detecting this current polio outbreak, which speaks to the sensitivity of its surveillance system, which is one of the key strategies in polio eradication. WHO remains committed to support the government of Kenya and the Ministry of Health to ensure that the polio is eradicated. WHO will continue to support ministry in these 4 arms. 1, it will continue supporting the ministry to strengthen routine immunization. 2, it will continue supporting the ministry to strengthen cross-border coordination. 3, it will continue supporting the ministry in conducting high-quality supplementary immunization campaign. And 4, WHO will continue supporting the ministry in strengthening surveillance system for both acute flaccid paralysis but also environmental surveillance. Thus far, the country has 17 environmental surveillance sites. It's good to know, our chief guest, that one of the cases was detected from one of the environmental sites in Nairobi. We reiterate that polio vaccine and other vaccines are safe and will protect the children from paralysis and death. Concerted efforts should be made by the Ministry of Health, county and sub-county health services and partners to reach all vulnerable children in hard-to-reach, mobile, pastoralists, refugees, immigrants, internally displaced persons, densely populated urban centers, and security compromised areas. We call on parents and caregivers. To ensure that children under the age of 5 in Nairobi, Kiambu, Kajiado, and Machakos, and children under the age of 10 in Turkana, West Pokoti, Busia, Bungoma, and Trans Nzoia are brought for vaccination from today, October the 2nd, up to 6th October. The vaccination team will be visiting homes and vaccinating all eligible children regardless of their vaccination status. We reiterate again that the polio vaccine and all other vaccines given in Kenya are indeed safe. In conclusion, our chief guest, our mandate as WHO requires that we continue to support the government of Kenya to ensuring that all eligible children are protected from vaccine-preventable diseases. We join hands with other partners and our sister agency, UNICEF, to ensure that we give all the support to the government so that we're able to achieve the goal of interrupting the transmission of polio virus in the country. Together, we can kick out polio in Kenya. Asante sana.
Asante sana. So ningependa munisikize kidogo. Mulembe swa. Mulembe mia. Mulembe te. Mulembe swa. CHPs mulembe swa. Mulembe mia. Very good. Sasa kabla sijamwalika mwenzangu kutoka the national government, wale wenzangu kutoka Nairobi, Wizara ya Afya, musimame mahali mulipo tafadhali. The national team, musimame kidogo. Thank you so much. Wave to the tafadhali. So la mwisho sasa, mtaniruhusu nimwalike ndugu yangu ambaye ametualika achukue fursa hii na kuendelesha mpaka mwisho. Karibu sana. Mpigie makofi 1, 2, 3. Fungua.
Asante sana. Ningependa kurecognize presence ya County Security Committee members. Kama muko tafadhali musimame. County Security Committee, Sub-County Security Committee, ama muko pale nyuma. Chiefs and Assistant Chiefs, mnaweza simama. Wazee mukasa, Village Elders, mnaweza simama. Haya, tunaweza kaa chini. Bwana Director General, ACCs. Thank you very much. Bwana Director General, yangu ni machache. Ningependa kuongea kwa mambo mawili tu. Ya kwanza, mambo ya Mpox. Sisi kama sub-county hii ya Bungoma West, tumehamasisha mashule zote 152 primary and secondary schools. We have activated hand washing katika shule zote ili tujaribu kucontrol pia mambo ya usafi na to prevent mambo ya afya isidhuru watoto. Vile mnavyoelewa, hii border point yetu ya Lawakaka ina handle takriban magari 300 hadi 500 kwa siku. That is a very big volume. The vehicles all the way from DRC Congo, South Sudan, Uganda, Rwanda and Burundi pass through this border when they are empty, when they are going back. So we are handling so many people at the border. Sisi kama kamati tulikaa chini na tukahakikisha kwamba provide sanitizers 100 liters kwa border management teams hapa. Ya pili, mambo ya shift, ningependa kujulisha Bwana DG, last week tulikuwa pale Kenya School of Government with the Director General na tukapatio marching orders ili tujaribu to register watu katika Social Health Insurance Scheme. Na hapa Bungoma West, in the last 5 days, tumemanage kuregister 21,900 residents. Hiyo yote hatungeweza bila ushirikiano ya machief, assistant chiefs, village elders na community health promoters. Nilitumwa na maombi. Community health promoters walinituma niongeleshe county government. Mshahara yao kwa muda hawajapata. Lakini national government mshahara yao wamepata. Sasa county government muangalie hii watu. Mnaweza simama community health promoters. Hii ndio ile jeshi ilitusaidia. Na ni muhimu sana county waziri mujaribu kuangalia welfare yao kuhakikisha kwamba pia watatusaidia katika mambo ya afya on the ground, in the ground here. With those few remarks, ningependa kuchukua hii fursa tumkaribishe Director General. Haya, tutiarishe ile makofi ya Kabuchai. Si mnajua? Moja. Karibu. Director General. Fungua.
Asante sana County Commissioner. Nilikuwa ninataka kuvaa hii kofia ndio nikuwe na full uniform. Lakini nimepata hapa kuna joto sana. Sasa nafikiri nitaiweka hapa ndio nikuwe naiangalia hata ninapoongea. Kuna mengi yamesemwa na sitataka kurudia. Wale wenzetu ambao sana sana kutoka kwenye partners wamesema mengi ambayo mimi kwa niaba yangu mimi mwenyewe ningependa kusema. Kwa hivyo sitasema mengi sana. Nilikuwa nimefikiria nizungumze kwa Kiswahili kwa sababu nilijua kuna wageni wamekuja. Kwa hivyo nilikuwa nataka hata kama kuna kitu tunataka kuwasengenya kidogo wakose kusikia. Lakini sasa walipofika hapa nikaona wanazungumza Kiswahili. Kwa hivyo haitasaidia sana. Mutaniruhusu nizungumze kwa Kimombo. So as you have been correctly told, my name is Dr. Sultani Matendechero. I am the Deputy Director General for Health at the Ministry of Health, State Department for Public Health and Professional Standards. Specifically, I am here to represent our Principal Secretary, Mary Mudhoni, who up to this morning was actually very keen on coming here because of the importance of this function, but was not able to come understandably due to the exigencies of duty. And also by extension, I represent the Ministry of Health to join other partners, other sectors of government in this very important process. So County Commissioner, representative, our County Executive Committee members who are here today, na Madam CC, wakati ulikuwa unaongea mambo ya ile vitu mlikuwa mnafanya pale kwa boda, nilikuwa na wasiwasi kidogo kwa sababu nilikuwa naangalia County Commissioner na nikawa na wasiwasi sana. Lakini bahati mzuri najua ulisema kwa lugha ya hapa. Sasa hakuelewa ulikuwa unasema nini. Kwa hivyo hatutarudia hiyo. Lakini asante sana for joining us. I want to recognize the political leadership of the county together with the other political leaders who have joined us. I also want to really recognize the presence of our polio champions, my very good friend, Honorable Senator. I usually call you Ambassador because of the good work you're doing for polio. Ambassador Harold Kipchumba, together with our county polio champion, representatives of partners who are here present. I know that we've heard from them, WHO, UNICEF, and all the other partners, Kenya Red Cross Society, and all the other partners who are here today. Guests from our neighbor and sister country, Uganda. We are very happy to have you. We are actually encouraging you to continue learning Swahili because we want the whole of Africa to be able to speak in one African language so that we don't go, when we go to Uganda, we are translating and speaking in English and French, and yet we are Africans. So, muendelee hivyo hivyo, muendelee kujifunza Kiswahili. Colleagues from the National Ministry of Health and members of the press who are here present, all distinguished guests, ladies and gentlemen, it is a great honor to be with you today as we officially launch the polio vaccination campaign commencing today, Wednesday, the 2nd of October 2024, and continuing for the next 5 days. This campaign will cover 9 high-risk counties, including Nairobi and 3 neighboring counties, as well as 5 counties in the Western region. I sincerely thank you all for taking the time to join us for this important occasion. Ladies and gentlemen, disease remains one of the greatest threats to humanity worldwide, often leading to premature death or long-term disability, especially among vulnerable populations. Children under 10 years of age are particularly susceptible due to their developing immune systems. This is why governments invest heavily in preventive measures, especially vaccination, to protect children from life-threatening diseases. Among these diseases is polio, which